Morning, Sharif.
Morning, everybody. Hi, Imran.
Morning, how are you? Nice to see you.
Good to see you.
Yeah.
Okay, great. Sounds good. We'll get started right on time today. So welcome, everyone. So we have the pleasure of having Dr. Imran Jivraj joining us this morning. And actually, my colleague Dan DeAngelis is going to introduce him this morning.
Good morning, everyone. So my name is Dan DeAngelis. I'm the Chief of the Ophthalmic Plastic and Reconstructive Surgery Service, and it's my distinct honor and privilege to reintroduce a colleague and friend to you, Dr. Imran Jivraj, as our visiting professor. Dr. Jivraj has unique qualifications in that he's dually trained in both neuro-ophthalmology and oculoplastic surgery, and as such, he's really one of the few people in North America with such training. He completed his Bachelor of Science degree at McGill University, followed by medical school at the University of Toronto, where he was awarded the Golden Stethoscope Award, an important award for medical students that illustrates compassion, caring, and academic excellence. He did his residency in ophthalmology at the University of Alberta and fellowship #1 in neuro-ophthalmology at the University of Pennsylvania. We were fortunate that he decided to pursue a second 2-year oculoplastic fellowship with our group here at the University of Toronto. At that time, he was awarded the Chair's Award for Outstanding Service. He's currently a lecturer at the University of Alberta, where he's engaged in teaching and the residency program. He was inducted into the prestigious ASOPers Society in 2020. His research seeks to develop a pathway for acute ocular stroke, and he enjoys swimming, tennis, and stamping out vaccine hesitancy. On a personal note, he is a dad to a newborn Camilla, who's the baby sister to Isra, so he can fully blame me that a sleep-deprived dad has to talk for 4 hours at 5:30 a.m. Edmonton time. Now, Imran has a perpetual smile on his face and loves to show off his shiny whites, as you see in these photos. The only exception is when he puts on his Edmonton Oilers jersey, as you can see on the right, but then I guess who can really blame him? We'd all be sad if we had to wear an Edmonton Oilers jersey as well. We tremendously enjoyed our time in Toronto and are very much looking forward to his grand rounds in neuro-ophthalmology. And I know the residents are looking forward to his talk later this morning on oculoplastic surgery. So please welcome Dr. Imran Jivraj.
Thank you very, very much, Dr. DeAngelis. Let me just get my slides going here. And I'll just share my screen. So thank you very much for that lovely introduction. I lost 3 of my most recent pearly whites to a late in life wisdom teeth extraction. So, still recovering from that, but the Oilers are doing well in the preseason, so we can always hope. Today's topic will be a presentation called Let There Be Light, and I'm hoping to shine a light on optic nerve anatomy, physiology, and treatment. But before I do, I'd just like to reflect again on my time in Toronto, where I got to work with these amazing individuals. I still have wonderful memories, dreams, and sometimes nightmares of my long distance commutes to Bowmanville and Hamilton on a weekly basis. And I developed exquisitely close relationships with many of the residents who felt comfortable calling me at all hours for 2 years. But it forged the basis for beautiful friendships, and I still really enjoy seeing how they've matured and how they've developed and gone on to start many of their own practices. So my time in Toronto was formative for a number of years, and I will always enjoy that part of my training and the friendships I've developed. I always like to shine a positive light on Alberta and Edmonton whenever I get the chance to speak. Usually I'm highlighting our beautiful natural scenery, which I show here in a photo behind me of Jasper, or perhaps highlighting our beautiful river valley, and even sometimes our world's almost the largest mall, which we've had for many years and is probably the biggest attraction. Unfortunately, the current problem in Edmonton is COVID out of control, and it's related to difficulties with vaccine hesitancy in our population. And so this is a scene from my hospital just earlier this week, where military nurses were actually brought in to help ease the pressure on critical care units. So we now have a number of members of the military in our ICUs kind of helping out, and they've come from all across Canada. So it just kind of shows you that when you need help, other people are always welcome, happy to step in. But it's also an important lesson in following public health measures and taking medical problems seriously. Before I begin, I wanted to do just 4 questions to kind of gauge your attention and get an idea of how we're all feeling about retinal ganglion cells. So the first question, and I'll just bring it over back here, is thinning of the retinal ganglion cell layer on OCT. A is suggestive of a primary photoreceptor dysfunction. B may be seen earlier than RNFL loss on OCT and optic neuropathies. C is typically seen days following an occipital stroke, and D is diagnostic of a mitochondrial disorder. Everyone, feel free to vote. I'm not sure.
So it's running. I'll give it a couple more minutes or a couple more seconds.
Okay.
All right, here we go.
Very good. Okay, so hopefully they get a little harder here. Next question. Which of the following is true about retinal ganglion cells? I think I'm hoping it doesn't say false on the question in your slide.
Yeah, my question says false.
Okay, it should say true.
Okay, so
That's fine. Retinal ganglion cells are the initial site for retinal phototransduction. Energy requirements are highest in the myelinated portion of the axon. The length of the retinal ganglion cell axon is approximately 5 centimeters, and the retinal nerve fiber layer is an extension of retinal bipolar cell axons.
all right, Imran, this is bringing back OCAP memories.
I know this is actually toric material that I'll be.
Perfect. So you've got a better split here. You've got the audience split here. I'll show you the results in a second.
Okay. Great. I love the distribution here. Excellent. Okay, let's go over to the next question. Question 3, which of the following is not a mechanism in primary open-angle glaucoma-mediated retinal ganglion cell death? A, reduced axoplasmic transport along retinal ganglion cells. B, increased translaminar pressure gradient. C, extracellular matrix changes at the level of the lamina fibrosa. And D, inflammation within the optic nerve subarachnoid space, which is not a mechanism. Oh my gosh. Okay.
People are awake now.
People are listening. I love it. Okay, so question number 4. Papilledema in pseudotumor cerebri may be caused by increased protein in the cerebrospinal fluid, compartmentation of CSF in the perioptic subarachnoid space, loss of myelination in the retrobulbar optic nerve, or meningeal inflammation extending to the optic nerve.
So we're starting to see a bit of a split again. I'll show you the results here.
Okay. So there's a little bit of learning that we can take place this morning. Thank you so much for helping with that poll. All right, so let's move on to our presentation. So today, I thought being 2 years into practice, it would be nice to reflect on some of the conditions that we all encounter in our practice and go a little bit deeper into what's actually going on under the hood. We're used to diagnosing these pathologies. We know the first line treatments for them, but the cellular mechanisms and physiology underlying retinal ganglion cell function. We're going to talk about optic nerve anatomy and pathophysiology as it relates to those conditions. And then we're going to talk about some new and old surgical, medical, and other types of therapeutics in the management of these various optic neuropathies. And I certainly want to stamp out the idea that neuro-ophthalmic diseases are not treatable, because there are many treatments coming down the pipeline and many treatments that are currently available that can make a great difference for our patients. the story of light really begins in the retina at the level of the photoreceptors, where they stay in a rested, depolarized state. And this is called the dark current. It's actually quite a cool title for this phenomenon. But basically, unlike other neurons in the central nervous system, neurons or the photoreceptors are constantly depolarized. And this is because of voltage